Hello, my name is Sofia Bezerra de Oliveira Costa, medical doctor and PhD student of Doctoral Program of Neuroscience, Faculty of Medicine, University of Porto, Portugal. I'll be presenting multiple sclerosis-related optic neuritis, a retrospective observational study. Optic neuritis is an inflammatory disorder leading to sudden painful monocular visual injury that takes place over the course of several hours or days. It is mainly idiopathic in nature, but it has variable causes. Out of these, MS is the most common cause of demyelinating optic neuritis. Corticosteroids have been widely used in the treatment of optic neuritis. However, controversy remains regarding whether there is a difference in clinical outcome between hyperacute treatment versus acute or delayed treatment. So our growing interest is to evaluate a correlation between clinical outcome and timing of corticosteroid treatment initiation. We performed a retrospective review of medical data comprised of 156 patients with ON admitted to the ward of our neurology department at Centro Hospitalar Universitário de São João between January 2004 and August 2019. Clinical data, treatment protocols, and discrete relapses, including optic neuritis, on follow-up were analyzed. Our cohort comprised 156 patients. Out of these, 44 multiple sclerosis-related optic neuritis. The cohort comprised other diagnoses as well, as it follows: idiopathic optic neuritis, ischemic optic neuritis, neuromyelitis, optic spectrum disorder, and other causes as well. 2 patients of multiple sclerosis optic neuritis were excluded because there was no information available regarding treatment. IV methylprednisolone was administered for a median of 5 days as initial treatment. The median follow-up time was 82.6 months. Hyperacute treatment was performed in 9 patients. 3 out of 9 didn't show any relapses. None of these had ON isolated event. Regarding acute treatment, out of 26 patients, none of them have presented ON relapses on follow-up. Out of these, 14 patients didn't show any relapses. Regarding delayed treatment, this group comprises 7 patients. 4 patients didn't present any relapses, and none of them presented ON event on follow-up. The average difference of visual acuity of the affected eye between admission and discharge on hyperacute and acute group was respectively 0.7 and 0.4 out of 1. Furthermore, there was a positive correlation between the interval of spanning from symptoms onset to treatment and the incidence of ON relapses on follow-up. So in conclusion, our analysis suggests that prompt corticosteroid treatment may reduce the risk of optic neuritis relapses on follow-up. However, important limitations exist, and it's important to highlight as well that further research is needed in order to validate our results. Thank you very much for your attention.